Good evening and thanks very much for joining us. I'm Brittany Ramsey. There's been another COVID-19 death in the Thunder Bay District today. It's the 59th of the pandemic, and it tempers the continued positive news regarding the district's overall falling case numbers. Today, the health unit is reporting a two-day total of 8 new cases, as it no longer reports case numbers on Sundays. 6 cases are in the Thunder Bay area and 2 are in First Nation communities. There are 2 from close household contact and 2 from close contact outside the home. 4 have unknown exposures. The total case count now sits at 3,012, and the number of active is now down to 49. The latest hospital numbers also show positive signs. There are now 12 COVID patients at the regional. 5 are in the ICU. Both those numbers are down from Friday, and the hospital is currently about 84% full. And T-Baytel customers woke up to outages this morning. It was due to planned maintenance work on its mobility service core. And simultaneously, Rogers Communications had a nationwide outage. The outage also caused delays at the district health unit's COVID vaccination clinic at the CLE Coliseum. Many people were left waiting outside as vaccine appointments are running 45 minutes to an hour behind schedule. The health unit blamed the T-Baytel issues for the delay, but said they had backup plans in place and that the clinic continued to run without any interruptions. Ken Spicer was one of those waiting outside after his appointment time was pushed back.
Well, they mentioned when I first got here that they were about 40 minutes behind because of T-Baytel. There was some kind of outage with T-Baytel. So it's all understandable. People have to be patient. That's all I can say.
It was a cold wait, but it was well done once we were inside.
As of 3 o'clock this afternoon, T-Baytel said its mobility, voice, and data services have been restored, and texting would continue to be restored gradually. Meanwhile, Rogers says it's working hard to restore services for customers who continue to experience wireless interruptions. 4 local pharmacies that are administering the AstraZeneca vaccine are prepared to begin giving the shot to those who are 40 and older tomorrow, as per the new provincial regulations. Oak Medical Pharmacy on Arthur Street, Dawson Heights Pharmacy on Regina Avenue, Shoppers on Red River Road, and Safeway on Court Street are all authorized to distribute the vaccine. Dawson Heights owner Vinay Kapoor says he's been getting a lot of calls from those who are now eligible.
The phones have been ringing nonstop since the announcement came out late yesterday of the eligibility change to 40 plus. So yeah, there's going to be a big demand as we go forward here. I think it's great. More people get vaccinated, the more we can get through this pandemic.
Dawson Heights currently has about 150 to 200 doses left of the 300 that came in on Friday. Kapoor is hoping to get another shipment later in the week. Meanwhile, over at Oak Pharmacy, owner John Potvin says they're able to administer about 30 to 35 shots per day. Vaccination appointments at any local pharmacy can be booked online. Ontario is reporting another 4,447 new cases today. That's down from over 4,800 back on Friday. Now, that's led to some speculation. The situation is beginning to stabilize. But while the province waits to see if the downward trend will continue, the Ford government remains under scrutiny after backtracking some of its latest COVID-19 measures. Colin DeMello reports.
After a controversial weekend, finally some clarity. The Ford government is admitting that the decision to shut down playgrounds and grant police sweeping new powers wasn't based on a scientific recommendation from the Chief Medical Officer of Health.
No, Dr. Williams recommended to us that we reduce mobility as much as possible and that we make sure that people follow the public health advice that he's been giving to us for the last year.
The Premier and his cabinet took the advice on reducing mobility and expanded on it, ordering municipalities to rope off playgrounds and giving police the power to stop people at random if they were breaking the stay-at-home orders, an order that the government says was misinterpreted.
Carding was never our intention. We did realize that police stopping vehicles was not the way to deal with it. It was more important for police to be able to break up large gatherings if people are not following public health measures.
The government was forced to backtrack on Saturday, chalks it all up to a communications failure.
It wasn't our best weekend communication-wise, and especially given how challenging this has been for the people of the province of Ontario.
But now the question is, what exactly is this government doing to curb the third wave? While the Science Advisory Table recommended closing non-essential workplaces last week, The chief medical officer of health is still undecided.
If they're non-essential, then they should be closed. If they are essential by definition, then we'd have to look at the cost of closing those, and would that cause any harm to people who couldn't get something that was vitally necessary.
And another recommendation to give employees paid sick leave was rejected today by the Ford government in the legislature.
Agreed? Heard a no.
Critics call it a failure.
It is a breakdown in government. That's what it's been. We fell off the cliff, and the government didn't have a net there to catch us. And we are still in free fall, and they are still refusing to put the net in place.
While the government didn't offer an apology, they offered this.
Have we been perfect? Absolutely not. We will not, and we will continue to make mistakes.
Mistakes that frontline doctors fear will cost lives.
Meanwhile, Northwestern Ontario's NDP members are sounding the alarm bells. This after Premier Doug Ford informed NDP leader Andrea Horwath that he's considering shutting down in-person debates at the legislature by Wednesday. Horwath says her party members will refuse to cooperate on virtual parliamentary sessions until the Ford government reverses some of its recent COVID measures. Those include canceling the police powers announced Friday, passing Bill 239 to give Ontarians paid sick days, shutting down all non-essential workplaces, and providing more support for business and workers affected by closures. Now, all four of those matters were rejected by the government at Queen's Park today. In a phone interview with Dougal Media, Thunder Bay Atikokan MPP Judith Monteith-Farrell says the idea of switching to virtual debates at this time is ridiculous, and she believes the government is trying to hide from the public. Meanwhile, Quetnung MPP Saul Mamaka supports his party's stance.
We have to understand that, if they keep this up, thousands of more people will die. People will get sick and lives will be lost. And we cannot have that. People need to be paid, need paid sick days, not carding. People need vaccines, not police pulling them over.
The legislature is currently scheduled to sit until June. And part of Ontario's new measures include checkpoints at provincial borders. And on Sunday, OPP officers started setting up at the Manitoba border. This to control essential and non-essential travel between the two provinces, something Minister and MPP Greg Rickford supports. Adam Riley explains.
Beginning Monday, we're setting up checkpoints at all interprovincial borders.
As of Monday morning, those checkpoints are up and running. So far, the OPP have allowed hundreds of vehicles to pass through, with only one vehicle being turned away, according to an OPP spokesperson. Kenora-Rainy River MPP Greg Rickford says these measures are about protecting both the region and Western residents who have properties in the Northwest, while allowing essential traffic to continue.
Enforcement, mobility, and vaccines are the three critical challenges that we face in this wave. And we're taking efforts targeted to generally reduce people's mobility, and that's what's behind there. I was out at the OPP border control station last night. They've got a great setup. Commercial vehicles are going through unimpeded.
When asked why the province isn't taking a regional approach to the enhanced measures, Rickford says they will when they can, and notes that while, yes, numbers are on the decline in the Northwestern Health Unit, which services much of the Kenora-Rainy River riding, they're still classified in the red.
Being red for Kenora-Rainy River, one might argue, is more serious than some of the communities that are in gray. Many of the gray communities are clustered around large city centers, and even though their ICUs may be under significant pressure, they're proximal to other big hospitals. We have 4 ventilator capacity beds out here in the Kenora region.
And while Rickford says continually adding restrictions is not the preferred route, he accepts and supports what the government is doing, and notes depending on how things go, more could come.
The next scenario would be a far more aggressive shutdown that would primarily focus on manufacturing and essential construction activities.
But Rickford is hopeful it won't come to that, and that the new measures won't be around for long if the province and the region sees numbers drop. He is also excited about the new age category of 40 plus for AstraZeneca vaccines being implemented this week, and says he fully supports people opting for that vaccine.
Lowering it down to 40 brings me into play, and I'll be registering today so that I can get my appointment.
Adam Riley, TBT News.
Emergency services and a plan to revitalize the Victoriaville area sit atop tonight's Thunder Bay City Council agenda. Council members are being asked to approve the expansion of the Superior North EMS Community Paramedicine Program. The service has received $6.5 million to establish a new initiative for seniors awaiting long-term care. Up to 14 staff members will operate outside of 911 emergency operations to offer 24/7 support to those who haven't been able to access an LTC bed. Council is also being asked to adopt terms of reference for a new downtown Fort William Revitalization Advisory Committee. Realty Services Manager Joel DePuter explains that committee's role.
There's two jobs. One is to help with the removal of Victoriaville project, which is a huge and complicated project that involves ultimately building new public spaces and new streetscape, and thinking about how the buildings will look. So potentially developing design guidelines so that things can we can see a good result in the end. And also to determine a strategy to revitalize downtown Fort William.
Council decided back in October to demolish the mall. That's expected to cost more than $10 million, but Victoriaville currently costs the city nearly $500,000 every year to operate. Now, today was supposed to mark the return of in-class learning to local students for the first time since February 26. But of course, last week, the Ford government imposed a province-wide move to virtual learning following spring break. Some local officials say they have growing concerns about the impact on children's mental health. Catalina Gillies has that story.
Stress, isolation, and uncertainty are just a few emotions brought on by the COVID-19 pandemic. Many children and adolescents especially have felt those effects and are having a tough time coping amid the constant lockdown. Children's Center Thunder Bay is warning of the lasting impacts and calling for local schools to reopen. CEO Diane Walker says this full-page ad is aimed at Premier Ford, Minister Lecce, and Dr. David Williams, outlining her concerns and risks of keeping classrooms closed. She says schools play an important role in providing structure, support, and social connection, which she believes are the crucial building blocks to a child's mental health.
Lots of those kids, particularly kids that are on the margins or maybe aren't doing well or are struggling, can become lost or hopeless or discouraged. And it doesn't matter the amount of virtual stuff you offer. It doesn't matter how hard parents work. They just get really discouraged, really hopeless, really lost. Some are becoming suicidal. Some will go out of their beds.
Walker's letter further states that we are losing the mental health struggle and that keeping schools closed has a devastating impact not only on children, but families as well. Psychologist and CEO of Sullivan and Associates, Jennifer Sullivan, is echoing that sentiment. She talks about some signs that parents should watch out for.
If you see them acting less hopeful, more, doom and gloom, that things are never going to be okay. Watching for physical signs of stress and anxiety and depression. So those could be things like headaches and stomach aches that are out of the ordinary, changes in appetite, problems with sleep that weren't there before.
Walker hasn't heard back from the government yet, but she hopes that her letter will highlight the need for a regional approach to closures and accelerate vaccinations for education workers so that children can return to schools safely and as quickly as possible. Catalina Gillies, TBT News.
Well, the Winter Wonderland has returned to the Thunder Bay District. Sections of Highway 11 and Highway 17 along the North Shore were closed at various times throughout the day. And here in the city, the north side received mostly rain overnight, while parts of the south side saw a heavy dump of April snow. Corey Nordstrom has more.
Just a week after clearing debris from streets, city roads crews were out bright and early, removing snow from those same roadways.
We had resources out at 2 a.m. this morning. And then that included our sanding, our road sanders, and some of our plows and graders were out this morning. We had resources ready over prior to the start of the weekend, so we had equipment ready to go and staff ready to be deployed as well.
The Mountain Road area was hit the hardest, with nearly 3 times as much snow as the north side of the city, prompting locals to bring the shovels out, and a familiar noise was heard that many hoped was behind them.
I thought we were all done with this, so I cleaned up my snowblower and cleaned up the gas last week and put it back in the shed. But after I saw the weather last night, I had to take it back off and back out, and then start it again.
Got up about midnight and I looked outside and there was a couple inches of snow, so I didn't think it would be too bad. But I got up this morning, man, we got about 8 to 10 inches.
It's a well-known saying that every year, once it seems like spring, there's one more heavy dumping of snow on the way. Unrelated to their level of surprise, locals share mixed feelings on the latest weather event.
Mother Nature played a really cruel joke on us today. April Fool's Day is over.
Something to do during the lockdown. At least get outside and get some fresh air and shovel some snow. And
Getting snow in this part of the month is never a happy moment. It's December or January, I'm okay with it. April, I'm looking at more going for golfing than snowblowing, right?
Even though the rest of the week is supposed to bring weather that is much more typical for mid to late April, those that I've spoke to are going to play it safe and maybe keep the snowblower uncovered for a little while longer. Corey Nordstrom, TVT News.
Or he rocking the turtleneck in the snow.